thank you all for coming to the 6th Annual David Rothenberger Lecture. We're very pleased you've taken time from your busy schedules to be with us today. And we're very excited that Bill George accepted our invitation and will be our speaker tonight. Thank you very much. We are honored to be joined by some very special guests today. We'd like to recognize a number of university regents have joined us. And so to the Honorable Richard Beeson, Linda Cohen, Thomas Devine, Laura Broad, and Patricia Simmons, thank you very much for coming and being with us. We'd also like to acknowledge that Dr. Kaler, President of the University, is in the audience. Thank you. And lastly, Dr. Aaron Friedman, the Dean. I'm going to say just a few words and then Dr. Thank you for taking the time to come today. I know you're very busy and have places to be. Part of the invitation to be the speaker for the Rothenberger Lectureship is to spend time just prior to the lecture with participants in the Emerging Physician Leaders Program. I'll tell you about that in just a minute and tell you who they are. But I was there and I want to thank you for taking the time, Mr. George, to give your experience and your wisdom with the group. We really appreciate it. And we'd like to make a special welcome to the participants in cohorts 1 and 2 of the Emerging Leaders Program who are here with us today. The impetus for the Rothenberger Lecture came from the generosity of the faculty in the surgery department. Unbeknownst to Dr. Rothenberger, after a stint as the interim chair of surgery, a group of surgery faculty got together and contributed some money to start this Rothenberger Lectureship. Dr. Rothenberger was very, very honored and pleased to get it and decided that along with the lectureship, what he wanted to do was to expand the dialogue around leadership to participants, faculty in the medical school. The first thing he did was to ask me to go out and talk to department chairs, faculty, residents, fellows, students, to find out what the needs were, what were the kinds of things they wanted to talk about, in which ways did they want to be together. They really directed me to the population that is the population for the Emerging Physician Leaders Program. That's a 3-year commitment, quarterly meetings of a day and a half around various topics that we are together. And the audience was the newer and mid-career faculty. And so we're very pleased that the department chairs nominated the participants in the EPLP. And we are now almost to the end of our second 3-year cohort, so we're very, very pleased. And the other thing that Dr. Rothenberger did was he met with some significant community leaders who embodied successful leadership, understood what it meant to be a leader in a large, complex organization, and who had an affection for the university. That first group consisted of Wynn Wallen, Carl Plato, Luella Goldberg, who's with us today, and Vice President Walter Mondale. And from that, he came up with the principles that have governed the choosing of the Rothenberger lecturer, as well as the principles that we use in the Emerging Physician Leaders Program. So this is the 6th lecture, and we've been very blessed to have some just wonderful people come to do the lectureship. It was a brilliant choice to choose Vice President Walter Mondale, who, as it turns out, knows a fair amount about complexity and a little bit about politics. Our second speaker was Senator Amy Klobuchar, which was a wonderful day. She also spent time with the Emerging Leaders Program. It was just at the time they were starting the conversation, or had started the conversation about what became the Affordable Care Act. So it was very timely, and it was just a wonderful way for the participants in the EPLP and for the audience for the lectureship to get underway and having those conversations. Tom Sketz, who's a Minnesota native and the executive editor of Wired magazine, was our third speaker. The Wired magazine had just put out a series of very distinguished pieces on access to healthcare using some of the newer tools at the time, and it was very timely. It turned out to be a wonderful lecture. Mr. Brody, Dr. Brody, who had been here at the beginning of the AHC, was here to put some things in context, it was just a wonderful time that we had with him. Last year, we had Dr. Diana Chapman, who was the President Emerita of Wellesley College, who came. She was very, very thoughtful and tried to put some of the issues that we were talking about in the perspective of what she called the Humphreys America, Humphreys tradition. So we're very pleased to have today Mr. Dale George. Again, thank you for taking the time to be with us. So, Dr. Friedman, thanks again, and I'd ask you to introduce the speaker. Thank you.
Thank you, Tom, and I want to welcome everybody today to the 6th Annual David Rothenberger Lecture. And as you've heard, our speaker today is Bill George. Mr. George is a businessman and academic who's been deeply engaged with healthcare for the past 25 years. He's not a doctor, which is probably a good thing in these days, but I think also importantly, a perspective that we need. The former chair and chief executive of Medtronic, he's been a professor of management practice at the Harvard Business School since 2004. He currently serves on the board of the Mayo Clinic, ExxonMobil, Goldman Sachs, and is a former chair of the board of the Allina Health System. He's been on the Abbott Northwestern Hospital and the United Way of Greater Twin Cities. He's the author of 4 best-selling books, including True North and Authentic Leadership. PBS has named him one of the top 25 business executives of the past 25 years. So join us as Mr. George challenges physician leaders to step up to the issues currently facing the U.S. healthcare system as we navigate a journey from our current focus on disease to lifelong health care. Mr. George believes we need to develop a new generation of physicians who can guide us along this difficult transition. Please welcome Bill George.
Regents that are here, I'm honored that you're here today. Hope I don't say anything too radical to upset you, but I also want to thank my good friend David Rothenberger for inviting me to give this lecture. Judging by the people that have gone through it before, I'm in very, very distinguished company. I'm not sure I'm worthy of that, but I do have a message I'd like to deliver. So the basic thrust is, what are the challenge we have of getting physicians to lead our great medical institutions? That's certainly true of the University of Minnesota, it's true of academic health, but in many, many places that are crucial to healthcare, we do not have physician leadership. And so I acknowledge the challenges doing this, which I'll go into, but my underlying premise is that everything in healthcare starts with the last 3 feet. That's the 3 feet between my doctor and me sitting in her office or in the surgery room or doing a procedure of any kind. And it's only in understanding that, much as we would like to standardize the idea of common patients, we've never been able to figure out, because every human being is different and every medical ailment is different. And the risk I think we've faced is that we've started from the top down and tried to create a system which thinks about a generic patient and create a standard system using computers and all to do that. Now, look, I've been exposed to these things all my life and been working with them, and my background's in systems engineering, but I really think that it really must start and build from the patient up, and that everything in healthcare has got to be central to the patient. And nothing, I think any other solution is not going to get us where we want to go. And yet we've had not enough people really understand that. I confess I'm a Johnny-come-lately to medicine and healthcare. When I joined Medtronic in 1989, one of the greatest favors that was done to me was Win Wall, and I came in as President Chief Operating Officer. I'd been at Honeywell, I'd been in high-tech business for about 20, 25 years. Win said to me, Bill, don't worry about the numbers for the next 180 days. Go out and work with the doctors and see what they do. Now, I would not presume to understand what those of your physicians really do, but I did see in the 12 years, I took Win very seriously. I remember coming over here and seeing a pacemaker implant. I saw one of the first defibrillator implants here, and I saw over 700 procedures where I gowned up, arrive at 6 in the morning, put the greens on, and go in and see a series of procedures. And I think I saw enough to, as an observer, to read and learn from some of the best teachers in the world, because I've learned the best doctors are also the best teachers. In fact, every great doctor I've known is also a great teacher, because they want to teach, and that's their underlying motivation, just as they want to help patients. And I think I learned through that process how critical that last 3 P is, and we cannot in any way diminish that or deny it or not give it the credence it deserves or systematize around it. Maybe Walmart can with a great logistics system, so that everything falls into place neatly. I understand that form of business, but healthcare is a different form. And I think to do that, we've got to be thinking very differently about healthcare. Yet today, we're faced with enormous challenges in healthcare. Honestly speaking, I believe we need to reform our healthcare system. I'm not sure that the Affordable Health Care Act is going to get us where we want to go. It is an Insurance Access Act. I believe in access, where every American should have access to our healthcare system. But I'm still deeply concerned. It's not just the website. I think that may be the tip of the iceberg. I think some of the underlying premises are going to be challenged, and I'm very concerned about those challenges, about things that are locked in by law to the system. And so I think you're going to see a really difficult time for the next 3 years. We'll get through it. But I think those of us on the healthcare system have to find ways to push back and organize around it. For instance, one of the tenets of the law is you cannot provide any incentives to people for staying healthy. It actually doesn't say that. What it says is you cannot penalize anyone for being unhealthy. But the converse of that says is that you cannot incentivize anyone for being healthy. So every Medtronic healthcare plan would be thrown out by that one provision, because every single Medtronic plan provides significant financial incentives for being healthy. I think the whole idea for fee-for-service has just got to go, but we're and working with the people, CMS people closest to it, we're a long, long way from getting rid of it and really knowing how to pay for value. But I've said often, look, I will pay you to keep me healthy. I don't necessarily want surgery. I want to pay you for keeping me healthy. And I think we've got to get in our country much more this health mentality if we're going to make the system go. Otherwise, we're going to try to drive the wrong things. And one of the things I've seen in healthcare is I'm a strong believer in business that you get what you measure. The problem is we've been measuring the wrong things. I was chair of the board of a neighboring health system back 20 years ago, 15 years ago, when a lot of these things came in. And they were measuring productivity by how many patients a doctor saw per day, which they measured how many minutes per patient. Well, this said nothing to you taking good care of the patients. And it wasn't about productivity at all. And so basically, and I think a lot of primary care has been driven this way, and basically all you can do is 7 or 8 minutes and give someone a script. You don't have really time to see what's really wrong with them and what they're going through. So I want to throw out some ideas I have about how can we ameliorate the system, how can we make it better, and how can we get to a point where we have more physicians rising into leadership roles who really understand clinical practice. Now, I must say I've had a number at Harvard Business School, a number of MD, MBAs who are very brilliant people, well-intentioned, gone through Harvard Medical School, Harvard Business School, get a 2-year MBA, and I say, where are you going to do your residency? Well, I had this opportunity to go down to the administration, to go down to Washington and work. And I said, well, you're not going to do residency? Well, probably not. It's a long pull. And I just say to them bluntly, these are really capable people. If you don't do residency, you will never be seen as a real doctor. You'll have an MD after your name, but unless you do your residency. It's a long pull. My son John is 37 years old. He's still a fellow. He's a fellow at MD, and he's getting amazing training. 6 years to get to a 4-year medical school at Duke because he did 2 additional years of research and an MPH, and then 5 years of residency. You know what I'm talking about. This is the norm today. It's not the exception. And so it's hard to find time to lead within that time zone. So what are we going to do about that? And I want to acknowledge that time is a big issue, but I think we really have to find ways around it. It is a long, lonely road. In many ways, people lose sight of why they went to medicine in the first place during the rigors of training, and that's very easy to do unless they have some things around that can help them. And I think one of the things I've seen is lack of training for residents in leadership, and there really hasn't been any leadership training at all. And so I think we have to find, and nor early in career, but even young attendees, there aren't many leadership opportunities. Now, my kudos to David for creating the course. I just had exposure to the Emerging Physician Leaders Program here, EPLP, and I think it's a fantastic program to give exposure to leadership. But I often ask my students, are you going to teach us leadership? No, I cannot teach you leadership. The only way to learn how to lead is to go do it. There is no other way. We can talk about how you develop yourself, how you prepare for leadership, but actually learn how to lead, you have to lead. There's no generalized formula of leadership. There may be a generalized theory of physics, chemistry, mathematics. There is no generalized theory of leadership. Anyone that tells you there is really doesn't understand what leadership's all about. So, but let me throw out what I would call a contingent model of authentic physician leadership. So I hope you'll accept this as a contingent model. This is the way I've seen it, having looked at leadership for the last 30 years, what I think. I think it all starts with, why did you go into healthcare in the first place? Go back to that earliest time in your life. What drew you to healthcare? I doubt for the people who are in healthcare in this room, you went into it for the money. Okay, you get fairly paid. Sometimes you don't even get fairly paid. But if you really want to make money, you probably do work for Merrill Lynch, you know, because you could have started that at 22. So why did you go into healthcare in the first place? Go back to the earliest calling. My son John says, yeah, they went into healthcare because Mom was diagnosed with breast cancer when I was a junior at Amherst. And I gave up my spring break to be with her. And I saw that, and that's why I wanted to get the cancer surgery. And then he saw a mentor of his die of head and neck surgery. He had her tongue resected, and not surgery, but excuse me, head and neck cancer, and throat, and larynx. And he said, that's the field I want to go into, and that's what he's doing. But what calls you to? Maybe there's a childhood illness, but there's something in your life that says, this is where I want to devote my time in my life. My mother died at 20, when I was 24, when she was 61, she had cancer. In those days, we did cobalt treatments. Today, we look at it somewhat barbaric, but it was the best we had in those days. We did the best we could, but we couldn't stop the spread of cancer in her body. It was probably a blessing when she actually died of a heart attack. I think to really understand why you're really passionate about healthcare, you have to go back in your own life story. You have to understand what are the key events in your life that bring you here. What are the crucibles? Maybe you had a childhood illness. Maybe you saw a parent. Maybe there was something else. Maybe you had a mentor. Maybe you had a father or a grandfather who was a great doctor who drew you into the field. Those are all really important to go back and capture that. Because you can't lose sight of that. When you're faced with the rigors, you're faced with a disappointment, when life and death is facing you on the table, when you feel disappointed you've let someone down, somebody dies that you've done everything you could for, you need to go back to that inner purpose of what that's all about, and it starts with there. No matter how rigorous the paperwork is, the system, no matter how much it may be getting you down, I think you call to that inner place that says, this is why I did it, that's why we're doing it. That's one of the wonderful things Earl Bachman did at Medtronic. Our mission was to restore people to full life and health. And Earl never let us lose sight of that. I remember he spent 3 hours interviewing. He never asked a question about me. He just wanted to know, did I get it? Could I be passionate about this? Because I'd come from a high-tech field. Could I be passionate about this mission? Because he wasn't interested in having me ultimately become the leader of the company he founded. So we can't ever lose sight of what is that core mission, that real purpose that not only we as individuals, but our institutions, and we need to feel fully alive. So when the rigors of administration, the stress of the day, the long hours get you down, or disappointments in your work, you need to go with it. And you need to connect the dots from your history right to the present. Steve Jobs says very prophetically, you need to connect the dots in your life. That you cannot connect the dots looking forward because you don't know what's to come in your life. You can only connect the dots looking back. But you must do that to really understand What's important to you? When I look back at my time in Medtronic, a lot of people cite the fact that our market cap went from, $1 billion or so up to 60. That's not what's important. What's important is we went from restoring 300,000 people a year, new patients, those days, to 10 million today. That's what I resonate. And it's one person around Medtronic's having its annual holiday party where 6 patients come into the store. It's that one person, that one story that I resonate with. When someone comes up at Medtronic and said, thank you so much for that Medtronic pump that my son got because it's really helping with his diabetes. It's really made all the difference in his life. And he's now 20 and he's had it for 50 years and it's changed his life. So these are the things that I think call us to who we are. Because in truth, everyone who works in healthcare is or must be a servant leader. We are there to serve the patient. And if we ever lose sight of that, and ever think we're head of the institution now, we were there to serve us, we've lost it. We've lost sight of what we're all about. And within that, I think then our next task is to align people around the mission and values of our organization, and not let people ever lose sight of that. It's the patient that always comes first. And if we ever lose sight of that, we get caught up too much with our research and our funding, getting this R1 grant, getting whatever it is, cannot do that, to never lose sight of what the patient's all about, and put that into daily practice. I was down at Mayo one day, and the Discovery Channel was there, and I wasn't there at the particular time, but they went into a room, and there was a housekeeper there, and she was cleaning the room, so the Discovery Channel wanted to interview her. And they said, and they asked her, what's your work? She said, I'm saving lives. And they said, no, I don't understand. What's your job? What do you actually do? She said, no, you don't understand. I'm saving lives. Do you understand that one of the greatest causes of death in the healthcare system is all the germs and the infection being spread in people's rooms? And I don't have this room clean for the next patient to come in, then they're going to be subject to that infection. So I have a big job. My job is to save lives. And I have a checklist to do that. I go down a checklist, just like an airline pilot does. Your airline pilot goes right down this checklist. That's how I do my job. But she saw that bigger picture. Now, wouldn't you like to have everyone in your organization be like that housekeeper that saw that's what it's all about? Hey, this is not a very glamorous job. She's probably the lowest person on the totem pole. This is not a very glamorous job. In fact, I remember going out and talking to an employee at Medtronic. Because my next point is, it's our job to empower our team to lead. Who are the empowered leaders in your organization? Who are the people that step up? Don't look at the wiring diagram. Don't look at their title. Look at who are the informal leaders that are really empowered. And what do you think if you had an organization where everyone was fully empowered around helping the patients? They didn't worry about their difficulties. They were just empowered around that goal. I was visiting a Medtronic facility in Southern California that takes pig's hearts, and about 1 out of every 10 pig's hearts produces a valve that can, through chemical process and what is really an art form by someone that's very skilled, turn that pig's valve that's extracted from the heart into a replacement for the failed aortic or mitral valve in the patient. And this facility, we took about 18 months to train people, and this facility was way behind. You had largely Asian immigrants, legal Asian immigrants. And I met a woman named Trin. Trin was from Laos. And she had all of her instruments laid out on the bench in front of her. And I'm trained as an industrial engineer, so I said to Trin, explain to me how you do your work, and how is it you can turn out twice as many valves, 1,000 valves, as anyone else in this facility? I'd really interested in how you do your work so we can help everyone else do this mission. She wouldn't look down at her bench. She said, Mr. George, let me tell you something. My job is to make heart valves that save someone's life. I make 1,000 valves a year, and if one of those valves is defective, someone's going to die. Now, to you, 99.9% quality is considered exceptionally good, but I could never live with knowing that I caused the death of another person. But she said, you know what I think about when I go home at night? I'm thinking about those 5,000 people alive in the world today who are walking around having full active lives because of heart valves I made. Now, here's the one that makes about $22 an hour. Does anyone doubt that she's empowered? And is she a leader? Yes, she is a leader. You know what? She trains all the new employees coming through. She said, I'm my own quality inspector. She doesn't need a ton of people checking her work because she is so committed to her work. And she sets the standard. People go over and say, Trin, this is valve good, it doesn't pass our test. She becomes that standard. So think of everyone in the system being like that empowered leader. Wouldn't you wish for a system where everyone had that level of empowerment in their leadership. And so I think that's our job, to let them be empowered. And then the next step we have is, what are we doing to develop young leaders in our organization? Are we giving them the chance? I was given a chance to come here in 1970 as a 27-year-old to go from staff, and I've been in business all of about 9 months, to take over a failing microwave oven business. It was just in the fledgling startup stages, with about $10 million in revenues. It was just starting, and somebody bet on me. A man named Bob Bruder was willing to bet on me and give me the opportunity. I made mistakes, I made plenty. I didn't know anything about how you design a microwave oven. I didn't know how you produce one. I didn't know the appliance dealers that sold them, but I tell you, we learned. And we learned to put a team around me and learn some humility. You didn't have all that much of. You learn some humility by having people around you that know more than you do, that are experts in what they do. And that's how I learned to lead, by doing it. Are we giving young leaders here that opportunity? Are you picking out people that you think have that potential and giving them the chance? And I think we need to find more opportunities to do that in medicine, to see who somebody has a potential. Let's have them serve on a resident search committee. Let's have them serve on this larger search committee that we're looking for someone to come in and bring people, young people, into that process, to sit on national panels at various special medical needs. What are we doing to give more opportunity to young people for small leadership opportunities to start, so they can start learning how to lead now, and how to create a team, and what kind of role model are you setting as a leader that influences everyone else? Because I think that's critical. The next step, I think, is what I call authentic collaboration. Can we create healthcare authentic collaboration between players and a team? I was talking to a couple of family physicians, and they're trying to create their system so the doctor's time is optimized at the thing the doctor does well, that the nurse is empowered, the receptionists, the technicians, the people administering the tests are all empowered to do their job. So everyone excels at their work. Doctor's the captain of the team, if you will, the quarterback of the team. But you don't want 11 quarterbacks on the team. But I think we have to move from individual contributors to physicians as leaders of teams, where everyone excels at what they do. And if we have that kind of healthcare system, it's going to be a lot healthier, and that can spread throughout the United States, and Minnesota can become a model for that. And finally, the seventh element of my contingent model is what I call closed-loop leadership. As I said earlier, you get what you measure, so be careful what you measure. But we must have a closed-loop system. We must know about every problem. Everything needs to be transparent, open, no politics. And we need to get to a system where we're measuring outcomes, patient outcomes over the long term, not in terms of perioperative, post-operative, but 365 days, 5 years, 10 years. We need to know, what are the outcomes? Have we restored this person? And so not only the complication rates minimized, but that person's restored to full life and health. And I think when we get that, we're going to be far better off than if we measure the wrong things. And I think far too often we've been measuring just the wrong things. I can think of a major medical institution now that's got some of the best surgeons in the world, where they're told to double their productivity, which means twice as many surgeries. These are very fast surgeons, to fund research. But research has to fund itself. And we have to do the right thing, always by patient outcome. We need to get the whole system where we're measuring that on a national basis. But let's start here in Minnesota. Let's start at the University of Minnesota. Let's be the leaders in having those kind of measurements, so we know how to measure outcomes based on true patient outcomes over an extended period of time. And I think then we, as a healthcare system, need to empower people for self-care and to take care of them, so we don't always have to bring them in here. So those are my elements of physician leadership and how you get there. Now, how do you develop leaders with this kind of capability? And so let me talk about that. I think it starts with a high level of self-awareness. Now, if that were so easy, the Oracle at Delphi told us 4,000 years ago, know thyself. But the reality is we don't really know ourselves. We aren't all that self-aware. We say we are, we think we are, I always thought I was, but we aren't. I remember the story of Roy Vagelos told us, the former first head of research. He used to be at WashU, and then he went to Merck, and he became head of research and became CEO. I think he was, of his day, he's one of those guys I look up to, 20 years older than I am, or 15, who was really one of the great leaders of the whole business community. not just of the healthcare field. But Roy told us a story about how he got really scared when they wanted him to be dean, because he had with all due respect to Dean Friedman, he said, the last thing I want to do is shuffle paperwork around, make appointments, and go out and raise money. He said, I want to do medicine. I want to save lives. I want to stay in that. And that's why he made the decision at that point. He turned down a couple of deanships to go to Merck. He was always focused on the patient. And I think you're well aware of the story that Merck has, where he fervently just a drug for, mispronounced, I won't even try, but for river blindness, that they actually wound up giving it away because there was no viable market to it. But it set a standard and inspired Merck scientists for 2 decades. And then they lost sight of that, and the company took a big step back, and nothing was coming out because they were spending the money, but the motivation was lost. And Badgel is the kind of person who would sit down. He went to an executive dining room. He went and sat with his scientists and said, okay, what are your biggest problems? And tell me your problem. He said, oh yeah, we've got a team over in Japan working on that same problem. Let me put you in touch with people over there. I know someone in university in China, in Shanghai, who's working on that. Can I connect you up? He was always trying to be there at the level of people, the researchers are actually doing the work, and a very inspiring person. Now he gained self-awareness by understanding himself and his own life story and where he'd come from and what was really important in his life. Now, many people we found when we did the book True North went through difficult periods of crucibles. One of the most moving ones was the story Dan Bassella told. Dan is a medical doctor who ultimately became head of Novartis and was head of the company for 16 years. Dan tells the story when he was a young boy growing up in Switzerland, that he had asthma and sent them out to Switzerland to live with a family of 3 brothers and a niece who were all alcoholics. And he did that at age 5 and 6, and at 8, he contracted 2 diseases which in the 60s were considered life-threatening: spinal meningitis and tuberculosis. And he spent an entire year in a sanatorium after being in a hospital for a few weeks. He was in a sanatorium. His parents never visited him once in that time. And each week they would come in and do a spinal tap. And he didn't know what they were doing. He thought, because they'd all disappear behind the screen, he thought they were trying to kill him. He didn't know. He was a little 8-year-old boy. And so he would scream. And they said they would hold me down like an animal, one person on one leg, one on each hand, and hold me down. So then one day a new physician came in. And he said, son, let me explain this entire procedure to me. Treat him like an adult. He said, here's the way this procedure works. Here's why we're doing it. And he said, now what can I do to make this procedure easier for you? And he said, don't hold me down like an animal, just hold my hand. He did, and he said it didn't hurt. So I gave him a big hug. But Dan's troubles certainly didn't end there. He was close, never close to his parents, but he was quite close to his 2 sisters. One died when he was 10 in a car accident. Another sister died when he was 12 of cancer. His father died in heart surgery when he was 13, and his mother went away to a distant city, left him all alone. So here's this 14-year-old boy. Mother comes back once every 3 weeks. He gets into a motorcycle gang, gets in a lot of fights, a lot of drinking, grows up too soon. And finally at 18, he came out of that and said, you know, I want to be like that compassionate physician. He called this physician he met in the sanatorium when he was 8, the compassionate physician. I want to be like that. And he went to medical school at the University of Basel, and he became chief resident at Zurich. And we found out that when they said, you know, I think I can help more of my patient time. That's when we went to the pharmaceutical business. But of all the people of his era, this is the post-Vagelos era, he never lost sight of that. And he was the one who was always there thinking about patients, going to the clinical trials. That's where the drug Gleevec came about, because he found it down in the lab and being killed for lack of funds to do clinical trials, and he jumped in and brought that to market. He was always there. In fact, I wrote him about a friend of ours who was having a problem with graft-versus-host disease after having taken Gleevec. And so he wrote him back and explained all of his options to him. He didn't have to. He never met the person. He was the only one that really never lost that patient focus that Vagelos had and he had. Now, oftentimes we talk about defining moments of one's career. My defining moment was nothing so dramatic as that. I always thought I was going to be head of a large organization, but I was rejected many times in my life. I lost 7 elections in high school and college because I wasn't ready to lead. No one wanted to follow me until some seniors in college took me aside and said, Bill, no one's ever going to work with you, much less follow you, because you're so moving ahead so fast, you really don't take time for other people. And that was a hard blow to learn, because my mother always said, son, you have to make up for my failures and be the leader I wasn't. And I tell you, it was anything but a leader, and it was like a blow to the solar plexus when they told me this. But they were right. You know, that kind of honest feedback really made a huge difference in my life. And at one time, I was with Honeywell. I'd been there about 10 years. And on a beautiful fall day in Minnesota, when Penny had a good job, I looked at myself in the mirror. I looked in the rearview mirror of the car coming home. And what I saw was a miserable person. Now, I was one of 2 Arab parents to be CEO of Honeywell. We had 2 wonderful sons going into high school and junior high. We had great friends in this community. Penny has a good job. We have a great marriage. What's the problem? The problem was I was losing sight of what I call your true north. And I was playing the CEO game, okay? I was so eager to get ahead, going back to my father's admonition, go ahead of a major company son. I was playing the game. I was wearing cufflinks, which I don't wear. I was saying just the right thing to people, trying to impress the board of directors, trying to impress powerful people, trying to impress the executive committee, not being myself, not being the passion, normal, kind of checking my passion at the door and playing a game. And everyone else could see it, except I couldn't see it. But deep down inside, I was chasing all kinds of numbers. Instead of working with people, I was chasing numbers, 9 different businesses I was responsible for. And I wasn't passionate about it, you know? But I was kind of saying, I can do this, I can solve any problem. So I went home and told my wife, Penny, I said, Penny, I'm feeling miserable, I feel rotten inside. I'm really unhappy. And she said, Bill, I've been trying to tell you this for a year, you just refuse to listen. It's the person closest to you that sees you as you really are, and not the facade you put up. And she'd been trying to tell me for a long time, I don't have any blind spots, not me. Actually, I have a lot. And I remember going the next day to meet my men's group. I formed a men's group back in 1975. We've been meeting every week on Wednesday morning from 7:15 to 8:30 for the last 38 years. Without failure, there are 8 of us, and the same group has been together for the last 16 years. We had to do summer place. 4 of us have been together the whole 38 years. And so I told the guys what I was feeling. They said, well, you turned down Medtronic for a job 3 years. Why did you turn it down? I said, well, I was going to have a really big company like Honeywell, and Medtronic's kind of a mid-sized company. It's about a third of the size of the sector I have at Honeywell now. He said, why don't you give it a shot? So I remember calling Earl Bachman back. All he wanted to talk about was the mission of the company, as I said earlier. And I remember walking into Medtronic. I accepted the job. I remember walking into Medtronic, and I felt like I was coming home. I had this odd feeling. You ever had that, coming home to a place I'd never been before? And I remember coming in there, and I said, hey, this is a group of people I can learn from. We can take on big challenges. We can get ourselves organized to focus on really important things and fulfill the mission of this company. And I can tell you it was the defining moment of my professional career because it led to everything else that came. But I think in going through and processing that, I think we can start to understand what's really important in our lives. And I had to connect the dots. I'm still connecting the dots all the way back to where I was, some of the difficulties I had, and how you can lose sight of what your true north is and get pulled off course. We all can do it. So what's really important? How do you gain this level of self-awareness, okay, that leads to self-compassion? Because if you don't have compassion, that little boy inside that lost 7 elections, or that would sit alone at the lunch counter, true story, and none of the kids would sit with you, or the girls would turn you down for days, then you're always going to have that insecurity and anger, and you're not going to be real. That leads to that compassion. I don't think you can honestly have compassion for other people until you have compassion for yourself, for who you are as a human being. And that's what I think leads to great physician leaders, who really know how to process and who know who they are at a deep level. They're not trying to be something they're not. They're not trying to be, king of everything, the queen of everything. They really have that depth of understanding. And that leads to the ability to have a self-acceptance and ultimately a self-actualization. So you can do what you do best, okay? And be in your sweet spot, where you find you're highly motivated by what you do, and you're really good at it. Why shouldn't we play our strengths? Why shouldn't we organize people to get everyone in the best spot for them, where they can use their greatest skills and capability, and not try to peel people into jobs that aren't as well qualified? So how do you develop these capabilities? I would say to you, the research coming out now as a result of the neuroplasticity, it helps us understand Dan Bowman's ideas about emotional intelligence, is showing that above 120 IQ, maybe in an academic center like this, above 130 IQ, that the defining factor is not IQ but EQ. Emotional intelligence. What do I mean by that? Self-awareness I've just described. It's the ability to read an audience, know where people are, to relate to people, to understand their motivations, their passions, and to have the social skills to bring people together and align them around a common mission. These are the qualities in leaders we want to look for in physician leaders, we want to look for in healthcare leaders, to bring these qualities out. People that have a deep sense of self-awareness, a deep sense of caring, a real sense of their purpose, and they can develop those kind of skills. And I think when we do that, and we recognize that that's what's really important. It's not the resume that counts, okay? It's not what you have on your CV, it's what you have inside you. And the key to it is finding people that can integrate their head and their heart. If you think about what are the important qualities in medicine, IQ is important, but what else is important? Passion for your work, compassion for the people you serve, empathy, walk in the shoes of the people you work with every day, and courage. Courage to make a decision that goes against the grain, goes against what everyone's telling you, go left and you go right. The evidence-based medicine tells you to do this, but you have an intuition. You saw a patient like that somewhere locked deep in your brain 10 years ago. That the right thing to do is different than whatever it's saying. You have the courage to do it, knowing that it's a life or death moment, but you have the courage. Now you think about those four qualities: passion, compassion, empathy, and courage. Those are all matters of the heart, okay? You're not going to learn those in the classroom. You're only going to learn those through the den of deep experience and some self-reflection and processing. And those are the qualities I think we really want to flourish in. We want to allow to flourish. And the great leaders will be those that can integrate their heads and their heart. As Thich Nhat Hanh, the Buddhist priest, says, the longest journey you'll ever take in your life is the 18 inches from your head to your heart. And if you haven't made that journey, I don't think you can honestly be a good leader. Certainly can't be a good physician leader, certainly can't be a good healthcare leader, because it's all about it. Maybe you get away with it for a while on Wall Street, but even there I don't think you can do it. But particularly in healthcare, I think that's good. Well, how do we help people do this? I think two things are really critical that we all go through. One is to have we need habits that stay with us every day of our lives and label certain. One of them is an introspective practice. I think just working 16 hours a day is not going to get you there. You'll never be operating at full productivity for that time. Yes, it's stressful, yes, time. But you've got to carve out time to reflect. What did I do well? What did I not do well? To take out some of the worries you have, to push some of those things out and get to clarity about what's really important. I do it through meditation. I meditate every day. Some people do it through prayer. Some do it talking to a loved one or a mentor. Some do it by working out in the gym or taking a long walk, whatever it is. You're just sitting here studying, reflecting. But it is reflecting and bringing these, having some time in the day, every day, where you have an introspective practice where you bring it together. And I think that's essential. The other thing I think is essential in our lives is to have a support team around us. Who's on your support team? I can tell you my support team starts with my wife, Penny, because I tell her everything, when I'm frustrated, whether it's trivial, whether it's big, whether it's little fears, big fears. She tells me her worries. We share everything. Having someone like that who I can completely own. Maybe it's your spouse, maybe it's your partner, maybe it's your mentor, maybe it's your best friend. You don't have any of those, go hire a therapist, but somebody you can talk openly with and share everything. Okay? Second, we need mentors. Okay? Mentoring is a two-way street. Yes, I hope all of you have mentors. I hope all of you are mentors. But I think once in that interaction, it's a two-way street. I've mentored a tremendous number of young people at Harvard Business School. Many of you mentor younger people. You know, I always tell them, I'm going to learn more from you, you learn from me. And they say, how? How can you? I can learn about the life of what it's like to be 27 years old and be on the firing line and know the fears. You can learn the life of a young physician and the pressures they feel there, which may be different than when you went through it. You can learn this life and really understand it through mentoring. But you think of it. I think every one of us who's over the age of 40 needs mentors in their 20s or 30s. Okay, when you have I have a mentor who's 18 years younger than him. He's fantastic. He's got promoted to dean of Harvard Business School, but he's helped me so much. But I have mentees as young as 21 that are extremely helpful to me, and in their late 20s and early 30s. So we need mentors of all ages to help us really understand how things work. And then finally, I think we need a support group. We need to put a team. I happen to have this men's group I talked about. I also have a couples group. So when Penny had breast cancer, they were all there for her. When she went through her mastectomy, they were all there for me as well. Who's in your support team? You need to form that team now. Don't wait until you get in trouble. Time to have your support team is now. And we all need that. We need to create groups. We've had 3,500 people go through our program at Harvard this week. We put them half the time spent in small groups. You would think we've done it all in the classroom. They learn more from each other. And the idea of peer learning is really growing very rapidly. We need a support team that's there for in the most difficult of times. Think about if you just got a diagnosis, or your spouse did, for terminal illness. I guarantee you may have 25,000 followers on Twitter. You're not going to put it on your Twitter account that this just happened. Who are you going to turn to? Who are those people in your life that you're really going to turn to? And you need that support team. In good times and bad, not just bad times, but in good times as well. Who do you share your greatest joys with? And I think all of these things are critical for the future of healthcare. So let me just bring this to conclusion and say that I think if we can create a healthcare system where we have these kind of empowered leaders that really are caring leaders, we're going to make a huge difference. And we can give them opportunities to lead, that no job is too small, that you learn to lead every day on the job. You have opportunities. And you have opportunities to teach people how to lead every day on the job. We create a system like that. We're going to have a much more humane healthcare system and a much better healthcare system. And we're not going to try just standardize everything at the systems level. We're going to bring it to the human level and bring that forward all the way upward through the system so we can have a truly effective system where patient is really centered. So let me close with a little exercise I'd like you to think about. You're 97 years old. The good news is you live to 97. The bad news is you got about 3 hours to live. You're on your deathbed, you have heart failure. And all your adult children have come in to gather around you, say goodbye to mom or dad. And your grandchildren are there too. And they've come in from all over the world as well. And your favorite granddaughter looks up at you. And I'm thinking my granddaughter Dylan, who's a beautiful little 6.5-year-old blonde who lives in Munich, Germany, spent her whole life in Switzerland and Germany. She looks up at me and says, she calls me Papa Bill and says, Papa Bill, what did you do to make a difference in the world? What are you going to tell her? I hope you won't tell her in that vital moment that you made so much money she never has to work a day in her life like you did. But I hope you will tell her what was really important in her life. Just the time to think about that is now. Every day you're leaving a legacy with people you impact. You impact those people. Every patient, every person you encounter, every employee you work with, you're impacting people you never even met by the life you live. You are the mirror that's a reflection to other people, how they can lead their life. They're looking to you. And as a leader, you want to be proud to be that. You want to be a mirror that you can be proud of. But what is that legacy you're leading? Robert F. Kennedy, when he was alive, went to Johannesburg, South Africa in 1966. And he said these words. He said, few will have the greatness to bend history itself. Now, he was in the shadow of Nelson Mandela, who was at Robben Island at that time for 27 years for a crime he didn't commit. He passed away this week. But Mandela really did bend history. I know I won't. Some of you in this audience already have and are bending history. But Kennedy went on to say something very profound for all the rest of us. He said, few will have the greatness to bend history itself, but each of us can commit ourselves to a series of tasks to make this world a better place. And the sum total of all those actions will write the history of this generation. It's my hope and prayer that your generation will do it better than many ways mine have, and really create a great system that's there to serve people. Margaret Mead, the anthropologist, said, never doubt the power of a small group of people to change the world. Indeed, it is the only thing that ever has. So you don't have to look out there. You don't have to change the whole world. You can't eradicate poverty in the world. You probably can't eradicate disease in the world, but you can make a difference in the world you're in right now. Steve Jobs said 3 very profound things shortly before the end of his life in his Stanford graduation address. He said, the first thing he said was, go your own way, follow your own life, and don't let other people's opinions drive your decision making. The second, he said, don't let outside voices drown out your inner voice. Listen to your inner voice. He said, and third, most important of all, follow your heart and your intuition, because it tells you what's really true. And I think as leaders, whether physician leaders, healthcare leaders, or just leaders in our world, that all of us have to step up to that challenge of following our heart and our intuition. The great Albert Schweitzer, Nobel Peace Prize winner, said, I don't know what your destiny will be, but I do know this. The only ones among you who will be truly happy are those of you who have sought and found out how to serve. Thank you very much.